Around the world, specialists are dealing with a deadly new eating disorder that very few people know about.
They want to eat the foods that they like, and they only want to eat the foods that they like.
You've got your meal and you've got this little bite of disgusting morsel that's just looming, waiting for you to taste, and so now the whole meal is just awful.
Avoidant restrictive food intake disorder, what most parents just call fussy eating, can become extremely serious.
You would think you could reason with her. You cannot reason with her.
I just don't eat that.
So far, the medical profession said, no, it's fine, they'll grow out of it, but they never have.
This is not a fad or a phase, but the child is persistently only able to eat a restricted range of foods. They're avoiding entire food groups. Then it's time to pay attention.
ARFID is not like anorexia or bulimia. It is a new diagnosis, little known and less understood, leaving medical experts struggling to fight an age-old enemy.
I knew it wasn't right, but that's all he would eat.
Jake's case is a very extreme case.
We probably thought he was going to die.
In many ways, Jake Thompson is a typical teenager living in New Zealand. Loves his computer games and his dog. Quite likes his parents and his sister, but probably won't tell anyone else that.
Anthony's rocks all right?
Yeah, it's just annoying.
And he's okay with the idea that he could become the poster boy for a catastrophic eating disorder he'd never even heard of.
It all hit me like a ton of bricks. It just crashed on me at once.
He was so grey, he had no energy. His mate would come around and Jake would just have to go to bed. He'd have like shaking fits, like his teeth would actually be chattering. Probably thought he was going to die.
Jake was suffering from an unknown eating disorder, now called ARFID, Avoidant Restrictive Food Intake Disorder. Today, up close, he can only see simple shapes and contrasts, basically because he wouldn't eat his veggies. Jake is now legally blind.
Most of the shooting has to be done from quite far away, and my eyes don't see that far.
ARFID gave him such major health problems, he was like a character running out of credits, caught in a kind of life and death struggle.
Well, it was life and death. I mean, it's not kind of life and death. I mean, we're looking at a kid who obviously has had a pretty extreme case. He went blind from malnutrition, and he lives in New Zealand.
For a long time, Jake didn't look unhealthy. He kept growing, but had a diet some clinicians describe as beige, all soft, white foods. Diane was desperately worried about Jake's eating, but his doctors weren't. He'll grow out of it, they said.
But he's always very happy. He's got a wicked sense of humour. He thinks it's very funny to wind me up, and some of the stuff he says, I say to him, you can't actually say that to your mum. That's actually not appropriate. Since we've been through all the illnesses and stuff with Jake, we've got very close, and I've helped him with stuff that, you probably would never expect to help with.
So in hospital, she would have to hold the bottle while I urinate. Yeah, there have been plenty of funny times.
And that is pretty much Jake's diet. It was white bread, potato chips, chicken nuggets, and frozen chips. And I knew it wasn't right, but I couldn't get him to eat anything else. Just eat one pea. That's all you have to do, is just eat one pea. And so I got him to stick his tongue out and I put the pea in his mouth. And he just sat there with the pea on the end of his tongue and could not put it back in his mouth. And he had tears streaming down his face.
When she tried feeding me peas and stuff, I thought it was gross. I just wanted to eat potato chips.
We tried the multivitamins, and one time I physically chased him around the kitchen table, trying to grab him to force it into his mouth. And that's when I realised this is actually not working. This is not, if I've got to chase him around and then physically force feed him a vitamin when he's 10 years old and should know better, then there's obviously something not quite right.
Jake has a life-threatening allergy to peanuts, and dairy products make him ill. Allergic reactions, or choking on food, or very strong senses of smell or taste are some triggers of ARFID. Avoidant Restrictive Food Intake Disorder didn't exist in medical literature until 2013. But now eating disorder specialists like Roger Mislevich and Kelly Lavender are seeing an increase in ARFID referrals.
And the children that I see, they want to eat the foods that they like, and they only want to eat the foods that they like. So their ability to kind of eat a variety or a novelty of food, they refuse to have it.
A key aspect of the diagnosis is that it has an effect on either malnutrition or even weight loss, or it impairs the person's functioning in terms of socially or even family functioning if there are conflicts around meals at home.
Often parents have been to paediatricians, they've been to doctors, they've already kind of known something's not quite right but can't quite put their finger on it. So far the medical profession said, no, it's fine, they'll grow out of it, but they never have.
As most parents know, fussy food habits can become mealtime madness pretty quickly, even for a mum who's a registered dietitian.
So even with my experience as a chef and as a nutrition professional, I still ended up with a son who was fussy. And part of my dietetic training was don't make food a big deal. So if he didn't want anything, then his option was peanut butter sandwiches. But then when he started refusing foods that he'd previously liked as well, it was like, okay, that's not working. So yeah, we decided to do this is it. This is dinner. If you don't like it, well, that's just tough, and breakfast is the next meal. And it was horrible.
Jake's teenage growth spurt came with health problems, blurred vision and Bell's palsy, which froze his face. He started getting really, really sick.
I dropped out of school for a bit. I was too tired to leave the house. I couldn't be awake for more than 3 hours.
He said when I rubbed one of my eyes, I noticed I couldn't see out of the other one. So we went along to the optometrist and they scared me because he said there were 5 areas of concern and that Jake definitely had reduced vision in one of his eyes and he had a problem with both optic nerves and there was 3 other things. So they sent us urgently over to Christchurch.
Then I woke up in the morning and Mum thought I had had a stroke because this whole side of my face just didn't work. I couldn't close my eyes. It was just all frozen. Then I got the osteomyelitis in my bone, which is a bone infection.
So he's on IV antibiotics for that, and his eyesight just kept getting worse.
Still, none of the medical advice to Deanne linked Jake's illness to his very restricted diet.
And I kept saying, what's going on? You know, like, we get rid of one thing and then another thing pops up. I don't understand why all this is happening.
And then we saw the ophthalmologist, Sean Dye, and he took one look at my eye and knew exactly what it was.
He's got a vitamin deficiency. And I was like, whoa, we've had so many people look in his eyes.
So we knew that I was deficient in vitamin A, and then we did the vitamin test again and found I was deficient in everything.
That just blew me away.
New Zealand's west coast is undoubtedly beautiful, but not a major centre of medical research. In 2015, bitter about his eyesight and frustrated by his frozen face, Jake was referred to a small counselling clinic at Greymouth Hospital, where session after painful session, his counsellor, Janelle Vaughan, started the treatment that saved him.
Jake was quite sickly when I met him. We jokingly would call him Gollum because he had a really round face, really pale skin, and his hair was kind of stringy. He didn't look like a healthy 15-year-old boy should look. We just took a big whiteboard and we divided up foods you like, foods you dislike, and foods that you're neutral about. And the foods that he liked was tiny. There was not much to it.
Yeah, so she said that Jake had ARFID and that we needed to do an exposure therapy for him. And that was more or less make him eat. And that's pretty much what she did. She would just sit in a room and he had to sit there with the food and he was not allowed out until he ate it.
I didn't want to do it. I was quite happy to eat bread and chips for the rest of my life. I got forced into it by my parents.
I think back at one of our first sessions with Jake and he just sat in the corner and he pulled his hood up over his head and he just sunk back and he wouldn't even talk to us. He didn't want to be here.
We all know about the terrible twos. It is normal behaviour for preschoolers to refuse some foods. So how can you tell the difference between a preference and a problem? When does, I don't like that, become a full-blown condition like ARFID?
Yum, I want to go and play now. It's a common childhood thing to become fussy, but it's how, as parents, we deal with that.
Most children after the age of 6 start to kind of, quote, grow out of it and start to get introduced and try new foods, whereas there is a reasonably small subgroup of those picky eaters where they actually, in some ways, almost it gets worse.
The parent can tell that this is not just a child saying, I don't like this. It has a heightened sense of kind of anxiety and refusal to it that most parents know isn't right.
Duke University in North Carolina has quickly become one of the international hotspots for ARFID research. Dr. Nancy Zucker is looking at the root causes of a disorder that may affect 3% of us.
I think one of the things that's really interesting about ARFID is that we've neglected the emotion of disgust. Right? And disgust is a fascinating emotion that is hardwired to help us avoid contamination. And I think one really exciting area to understand ARFID is whether these folks have just a very highly tuned disgust system.
Most foods just seem gross to me. Like when people are eating them, sometimes I can't even stand to be near them.
Fussy eating in itself is hardly uncommon. We all know someone whose food habits are unusual. Kaylee McLaughlin is an accomplished sportswoman, so you could say she's managing okay.
I would like to become a professional horse rider. Chances are probably slim.
Kaylee has not been diagnosed with ARFID, but her food choices are highly restricted.
For breakfast, I'll just have toast and then Nutella. I have Nutella on everything. A container like this will probably last like a week. And then it's gone. And then I can't have breakfast because I won't have anything to put on my toast.
You would think you could reason with her. You cannot reason with her, and it is a total waste of energy. And not a piece of salad or anything like that would ever touch her plate.
Not salad. Definitely not salad.
We made burgers the other night, and I did a terrible sin and cut the cheese on the same chopping board as the tomatoes, and she wouldn't eat that cheese because there was a potential, not even that it did, there was a potential that that cheese might have touched the tomato juice. And yes, we tried, and we've had, tears and frustration and worries and all of those things, but she just won't. So you either, drive yourself crazy about it and stress everybody out and thump the table and, get frustrated, or you just, let it go.
Today is a competition day for Kaylee. A full round of events on 2 horses. And what has she eaten?
I had an up and go, and I had a few chips. And that was it. I'll probably eat loads when I get home, but I'm fine now.
If that's a problem, she's not letting it show. Today's results are so good, Kaylee wins the series for her class.
That's all clear there for Kaylee with whiskey and rye.
Parenting would be easier if children came with manuals. Dr. Kath Conlon and Emily Jones run a world-leading university clinic for children who are becoming fussy.
Before I worked with Emily, I did think that eating was easy. I did think it was a case of you take a bite of a food and it's in your mouth and you swallow it. It isn't always that easy.
Emily's surprising message is that eating safely isn't a reflex like breathing, rather a skill we learn. In this simulated clinic session, she's modelling different techniques for kids who may have been frightened off food, perhaps find it hard to chew or swallow.
We need to move our tongue laterally. We need to go side to side in order to help chewing, and we need to try and have a rotatory chewing action to be able to have especially hard finger foods. On the other side, we have children who their mechanics of chewing and eating are good, except for them, some foods that take a long time to chew feel very uncomfortable for them.
Oh, you're so strong. You got such strong, sharp teeth. Well done. My goodness. The tails are great because it allows us
to be able to get them to be doing what we want them to do with food, but on like a non-food item and something they don't find very scary. So it's a good way of getting them to think, let's do puppy dog bites, so they can remember that they've done that on their towel and that they can do it on some foods that we're going to introduce later. Now you've got your pepper pig chart. We use a rainbow chart, and green is for go at the end of that rainbow chart. However, there's 26 steps on there, and it might be that one of the steps is you touch it with one finger, you touch it with two fingers, you hold it in your hand, you wave it, you move up your arm, and I use a lot of singing, lots of play, singing like that, just to really help them desensitise. Can you feel the cucumbers through the bag? What do they feel like? Cold. They're cold, aren't they? Can you hold this for me? Could you wave that around for me? Well done.
For our children that have sensory issues and they really don't like the food on their hands, we keep a little hand cloth on the back of the child's chair. And so what we teach the children is anytime they feel overwhelmed, they can just reach behind them, pick up their hand cloth, and they can wipe their hands themselves.
We just got Marmite fingers.
I want to wash
fingers.
them off now.
Should we wash them off? Should we get our towel and we can wash it off?
If a child is really completely overwhelmed by a particular food or just at that time point, then they can often walk out of the room back to their parents or down the corridor. So hopefully what we'll do before a child gets to that state is we'll do something like what Emily's doing right now. So we've got a child that's rocking on a Swiss ball to try and calm them down.
And we just do really nice graded steps, and just at their pace. Sometimes it's faster and sometimes not. It just depends on the child. Oh, wow, very nice.
Quite often a parent will see a food come out of the lunchbox and they'll say, oh, she won't eat that. And then through the techniques that you've seen Emily use today, that child often does taste that food for the first time. And that's great. That's a real step in progress.
Good girl. Good girl.
How do you get a freaked out teenager who's never really eaten properly to do something they don't want to do? Janelle Vaughan studied the therapies for more recognised eating disorders, but Jake's case was so urgent, she adapted the treatments and labelled hers the chili method.
We would go in, the food would usually always be sitting already on the table ready, and then when it's like time to eat it and I can't, she would use distraction techniques, such as talking about like asking me about what games I'm playing, or she'd make me get up, walk downstairs, get a drink, or just walk up and down the stairs a couple of times.
Sometimes it would take an hour to an hour and a half for him to get through those bites, or that, just depending on the topic.
The worst session was where I had to have chili.
And chili was a combination of bad for Jake. It was a combination of tomato, which he hates, beans, which he had never tried, and corn, which he liked. So we sat down for the chili session, and it was the first time that Mum had come back into the session, so it was kind of a good midpoint. And he refused to eat it.
And as a mum, I would have done anything not to make him suffer, because he was suffering.
He'd get the spoon halfway to his mouth and just start shaking, just refuse. You just saw him dissolve.
I couldn't eat it. I tried so hard. Mum and Janelle were just saying, come on, just take a bite, and I was just thinking, no, just leave me alone.
He kind of reverted back to that early childhood of rocking. He was crying, he was just backing away from the food.
And swearing at both Janelle and my mum and walking out.
And I was like, whoa, there's my blind kid walking down the road. What am I gonna do? And I'm still sitting here, but I was really upset.
I was like, well, this is it. Like, you have to really hold this boundary at home as well, that he can't have electronics back, he can't have the things that he wants until he finishes this.
I tried to pick him up on the way home twice, and he wouldn't let me. So I just let him calm down. And then he rang me at work and said, I'll eat your stupid chili if you buy me some hot chips. I said, okay, that's a deal. I'll be home in half an hour. So he had to do 5 bites of chili, and then he got some chips. They were 5 incredibly small bites, but he still did it. So, and that's huge.
Rebecca Heath is typical of diagnosed ARFID sufferers. Her safe food is uncomplicated and soft. It's a cheeseburger. At worst, though, it could take over an hour to eat, if she managed to finish at all.
I feel like there's a voice inside my head that doesn't let me eat what I want to eat. Like, I want to go out, I want to eat Subway, I want to eat Indian food, I want to eat everything on the menu, but I can't. I don't like it. I can't tolerate it. The texture's weird. Chicken's too dry. I don't like rice, you name it. It's difficult to eat something I've never eaten before.
It was a really traumatic birth that we had. I think on reflection, we did have issues, and one is her lack of tolerance for everyday food. It was kind of, as a mother, pick your battle. And if cheeseburger was going to get food into her, then a cheeseburger she got. And it was better to see her enjoying some type of food rather than going hungry, because that's what she would do.
Sausage rolls, chicken nuggets, fish fingers, spaghetti, pancakes, basically whatever you find at a 5-year-old's birthday party. For me personally, if I'm quite upset, I won't eat, and that's quite common. Either you'll binge eat if you're upset, or you won't eat at all. And so for me, I wouldn't eat at all, and that's where the eating disorder image kind of came in, where because I wasn't eating, Mum thought I was anorexic, and that wasn't the case. And so I spent about 48 hours just Googling every kind of eating disorder there is.
She jumped online and good old Dr. Google. And, you know, it was 10:30 one night, sound asleep, and Rebecca burst into our bedroom and goes, "Mum, read this. This is me." So I look at her laptop, a bit blurry-eyed, and they talked about ARFID. And actually, the more I read it and the symptoms, I said, yeah, this is you, Rebecca.
And I was just so happy. I was like, oh my gosh, it's an actual thing now. Like, there's a final, I can finally be cured and recovered after nearly 18 years that I should have been diagnosed with years ago.
How do you think today's session went?
I'm a bit nervous next week for talking about the foods that scare me.
Yeah? Why? What worries you about that?
Because I'll have to face it eventually.
What was it like for you to fill out that list and come up with it?
ARFID sits in the diagnostic manual next to anorexia. They have some similar symptoms and treatments, but not the same cause. ARFID sufferers are not trying to be skinny.
A significant difference is with ARFID, where they are not concerned about weight, often want to put on weight, but have all the anxieties around eating itself.
With anorexia, parents know really well what the young person used to eat like. The difference with ARFID is, you know, it's been years that this person hasn't been eating certain foods. So parents are a little bit kind of lost as in terms of like, so what's normal and what shall I give them and what do they like and what don't they like? So there's actually a bit of confusion around that.
We think of anorexia as a predominantly female disorder, and the same for bulimia, and ARFID seems to either have much more of an equal sex ratio or even some studies showing more prevalent in males, so very different than other eating disorders.
For those of us who love our food, we can find it hard to understand how others are so deeply scared of it.
Super tasty, too. Yeah. People with ARFID are not making a choice when it comes to food. It's really, there's an aversion that's happening, and there's a reason that they're avoiding food, which is hard, I think, for the general population to understand, because they're like, well, just eat it. But just eating it doesn't work when you're dealing with someone with, you know, a severe anxiety to, you know, a food. Or multiple foods.
There was a real fears, but like people with spiders, scared of spiders. Well, you'd avoid spiders, but if you're scared of food, how are you supposed to live your life? And that's what it was a physical fear, physical anxiety with Jake.
So at the moment, steak is really, really scary for me. Like if my parents eat it, I won't want to be in the same room with them just because it's just, I'm fearful my parents will choke and die. And what do I do if that did happen?
For someone with ARFID, the anxiety system would have gotten activated. The food that they're afraid of, it becomes a threat, and it activates the survival system, the brainstem here, and then that becomes an automatic pattern.
After busting through the chili barrier, Jake's ARFID has improved enough. He's about to swap his tiny seaside hometown for the challenges of a much larger city.
Oh, that's wet enough.
No, it's not. We introduced 30 new foods through the food therapy. and he eats a lot of them regularly now. Well, after he'd been to the food therapy for a while, I would dish up meals and I'd do meat and veggies and potatoes, and I'd give him his plate, and he'd go, "Thanks, Mum," and he'd take his plate down to his room, and he'd come back and he'd go, "Empty," and he'd go, "Thanks very much." I just can't explain how that felt. That was like being in a movie world, a TV world. It just didn't even feel like our kid.
Don't just eat a potato.
So in a couple of days, Jake is actually going to Auckland and he's going to be doing the Kickstart program at Blends. It's like a whole group of vision impaired teenagers will live together in a hostel and they'll learn how to be independent and how to look after themselves and live in the real world.
Right, Mum.
Yeah?
What do I need?
Jake knows how important it is for him to keep eating. He's on annual checkups for his vitamin levels so that if there's any problems, we can start treating him straight away.
I'm not really worried about it. I'm just excited for what we're actually doing.
It's going to be really weird without Jake around.
Oh, there's one right here.
But I know one of the main things I want Jake to do this program for is that so he can't see properly, he's still the same Jake and he's still capable of so much.
How do you fold this thing?
So I feel that going to do this program will show him what he is capable of and give him that confidence he needs to go on and do anything he wants to do.
Afternoon, Jace and PJ getting you home on ZM. Okay, I'm going to blame you for this.
Extreme fussy eating is not just a childhood problem. Radio DJ Jason Hawkins has fussy habits that, by his own admission, take him into a slightly different category. And we all have things we really can't eat.
Yeah.
Mayonnaise is the enemy because people put it on everything. Whenever I smell it, it smells really tangy. It's normally 90% served cold, isn't it? But, yep, so, but that's another issue.
What's going on? Oh my God, don't. No, don't block your nose. Come on, put it in. Eat it. 3, eat it. It's in. It's in. And it's yours. I've never seen something so dramatic.
I would say I'm a picky foodie. What I mean by that, I love going out for dinners, love going to restaurants. I think the best way to sum up my taste is I prefer hot food over cold. Ham, cheese, love a ham and cheese toasted sandwich, as long as it's toasted, not cold. I won't eat apple pie. And I purely think it was because Mum and Dad had, 3 kids before me. By the time it gets to the 4th, you're not in the mood for the fight, just let them have what they want. I'm not that much work to live with, I'm fun.
I'm actually really fascinated because they've taken you away and they've done tests on you.
They asked me about fruit. I said, pineapple on a pizza, apple in an apple pie. And halfway through I thought, if there's nothing medically wrong with me, I just look like a really fussy little turd.
As a fussy foodie, Jace might be a super taster. Super tasters' experience of some normal foods taste foul because they have a dense concentration of the taste buds that react to bitterness.
Super tasters are more likely to have strong preferences, either positively or negatively. So they'll either like something or they will dislike something very strongly because for them, everything is like on the volume knob's been wound right up to 10.
We sent Jace and Jake to a plant and food research lab to meet food scientist Dr. Richard Newcomb to figure out whether their taste buds are to blame.
So if you lift the glass up to your nose and give it a smell, and put it down. So tell me about it. What did you smell, Jake? Anything, or did it
I didn't smell anything.
You didn't smell anything?
I think you've gone cheap on me as well. I didn't smell anything.
Oh, there you go. That compound is called beta-ionone.
Right.
It's the smell given off by violet flowers. You guys obviously haven't got the sensitive version of that receptor. You've got the insensitive version.
Right.
And
we don't have the superpower. That's what you're saying.
You don't have the superpower.
Okay.
I'm afraid.
All right. Cool. Glad we're clear about that. Okay.
But there'll be about half the people in a population will be able to smell it as a flower and half won't. This compound's found in orange juice and it's also found in Pinot Noir wine. So
I love a Pinot. So you just ruined that for me. Thanks very much. God.
Generally, we detect things like sweetness and saltiness and sourness reasonably similarly, but some of them we're quite different in what we can perceive. So bitterness is a warning signal for us. So if something's bitter, it's usually a poison or related to a poison. Something.
Yeah, it took a second for me. How about you?
Nothing.
Nothing?
Nothing.
Nothing?
It's quite a chemical taste.
No, nothing.
So, Jason, you're a prop taster, and Jake, you're not a prop taster.
Okay.
Do you like orange juice? You drink much orange juice, Jake?
I don't actually like the orange juice. I only drink the orange soda.
Not a fan?
No.
No. There you go.
God, you and I get along really well, Jake.
So they actually found nothing wrong with you?
No.
So you are just really, really
look,
difficult.
At the end of the day, everyone experiences different elements of taste and strength.
Apparently you refuse to open an orange.
It's the
Can you do it?
Okay. Oh, it's cold too. I've never ever peeled an orange.
Really?
I peeled a banana the other day. That was big for me. I rang Lou. Lou was at work, and I'm like, guess what? One of the boys wanted a banana, and I peeled it. And she's like, that's great, babe. I'm in a meeting. Can I call you back? Have you got a pen or something? Oh.
There you go.
See, and you smell it straight away.
How does it currently make you feel? Like, is it?
This is degrading. That's how it makes me feel. This is quite degrading.
This time is basically just normal. Part of your presentation, your problem was also that you increasingly developed that fear of gagging.
So for the past year or so, I've had these episodes where I'll feel like I'm choking on every single thing I eat, no matter if it's even just a drink, even a hot chocolate, I'll feel like I'm choking on it. And I didn't know why. And so these episodes are just getting worse and worse and worse. For a lot of people with ARFID, fear of choking does come along with the disorder, and that's part of the treatment process as well. But I think that feeling of choking comes from the level of anxiety I get. Quite big bits of chicken.
After her ARFID diagnosis, a key part of Rebecca's treatment is her homework, a food diary of everything she eats, alongside every food she has to try. She's taking small steps forward from the cheeseburger. Butter chicken is the latest addition to her mealtime options.
This would need to be cut up to about this size for it not to be scary, just because it's such a chewy texture of food that if I ate a big piece or shoved a big piece of chicken into my mouth, then I would start overthinking that I'm going to choke or that I'm going to swallow it the wrong way. And then I'll need to spit the food out, make sure that there's nothing in my mouth that I can choke on. So we're doing a food diary each day. We're trying to lower my anxiety rate around food. So it's just trying new foods every single day. I said Mum distracted me a lot, so I was able to eat an okay rate, and I ate half of the hash browns. I was very strict with myself. Yeah.
The last 4 weeks, she's been saying, I want to do this. She's got herself a plan, and she's working towards a lot of things, and she's made really good progress, and it's so pleasing to see that she wants to turn the corner and move forward.
Kaylee has also been working on a food diary with a nutritionist from a university clinic in New Zealand.
Did writing it down bring up any new information for yourself?
Probably that I eat a lot of Nutella and a lot of ice were the two things.
I wondered a little bit about those ice cubes. Tell me the story behind them.
It's just more interesting than drinking water, I guess.
Mm-hmm. Frozen grapes, frozen kiwi fruit would be very much like an ice cube. Is this something that you feel ready to try?
I think the idea of, like, if I think about something like an apple, I just don't eat that because I don't want to eat that. And I think that I'm fine and just, I don't have a problem. I don't eat main food groups like fruit or salad. I don't really feel like I want to eat fruit. ever, really. So,
But we're going to try.
of course. Yes.
So remember holding it, because you can chop your finger, don't you?
After tears and struggles with her young son Arlo and a growing pushback from his sister, Andrea found her solution in a dinner-time philosophy developed in the United States.
That's when I came across the Ellen Setter division of responsibility. So the division of responsibility, the parents choose the what, where and when. So they choose the food that they're going to serve, they choose where they're going to serve that, and they choose when. Then the parent's responsibility ends, and that's when the child takes over. And they get to choose what from that provided they're going to eat and how much. So there's no take another bite, oh, you're doing really well, all of those sorts of things, because they get perceived as controlling and pressure, and when we're pressured, even as adults, our tendency is to push back. What would you like?
Capsicum.
Capsicum? So we serve dessert at the same time for two reasons. One, it can feel comfortable to come to the table knowing that there's something that they really like, and then often they're more likely to try other things. And the other side of it is that it takes the status away from desserts and sweets and things. By serving them at the same time, they're just another food.
This is your book of medical records, Jake.
If you ask ARFID sufferers and their families what their experience has taught them, what their message would be to others, it would be, first of all, don't judge them. And secondly, seek expert help if you don't think a doctor is giving the right advice.
Yeah, it was really low. Like, I blame myself for a lot of it. I feel like a lot of it's my fault, that maybe I should have pushed harder to get help or pushed harder to get him to eat.
I suppose it didn't help that every time Mum brought it up in a doctor's appointment, they said, don't worry about it.
They kind of said that it was obviously bothering me and I should feed her a multivitamin because she was not anemic and she's not underweight, so then she's fine.
Mum didn't want him to say that, but he did, so, you know, I've just kept eating the way I have.
It's really important for GPs to know about avoidant restrictive food intake disorder. And that's really around, they're the first line to catch it. They're the first line to see kids that might be presenting with malnourishment, that might not notice it. They might just call them picky eaters. But if you see that consistently, year after year, visit after visit, it's really about pediatricians and GPs about seeing that and getting support at an early age to prevent an outcome like Jake.
After a few sessions, Rebecca is heading down the right path.
This is my ball dress that I'm wearing.
Planning her night at the school ball and hoping to start conversations with other sufferers. She's even designed her own clothing.
I do sort of think of myself as an advocate because it's not known in New Zealand. Like, I've told my best friends, and like, what the heck is this? Like, we thought eating disorders were just anorexia and bulimia. No one knows about it, which is why I've made the shirts. There might be heaps of people in New Zealand that have this and they don't know that they have it. I really didn't think I'd be able to make my own shirt about this. I didn't think I'd be able to talk on a documentary about this. I didn't think I would even make it to 18. I thought I would have starved, or I would become so unhealthy or unwell, or so skinny I just wouldn't make it.
Like any new diagnosis, people that have been struggling out in the community and thinking they're bizarre and strange and unlike anyone else, when you give something a label, suddenly they don't feel so strange. They can identify with other people that also identify the label, so they feel more understood. And also the biggest thing is research gets funded to study the disorder.
At Duke University, Nancy Zucker and her team are working on the best ways to treat ARFID by trying to understand whether a disorder with many different causes can still have a universal treatment.
When we got a bunch of kids with ARFID together to do a food adventure, the fact that they could identify with each other and realize that they were all having the same challenges enabled them to approach foods a lot more easier. So I think that group-based meal treatment is a really exciting thing to explore in terms of the treatment with ARFID. You know, when people say that they were a very picky eater and they grew out of it, right? To me, that's understanding that is fascinating to inform our treatments. People are able to approach disgusting things because they have a really meaningful reason to do so, right? You're a parent and you've got poopy diapers, right? And you're gonna absolutely clean up vomit, change poop because you love your child. But no parent's gonna be like, I love feces. You know, you just do it for a very different reason. And I think when people say that they outgrow picky eating, it's because they've hooked into some higher value that's made the approach of these disgusting things worth it in the service of their athletic performance or their relationship. And I think that that's where a really exciting avenue for treatment.
I am getting a lot better. Fruit's definitely still a no-go, although I walked past a raspberry and apple pie in the freezer section the other day and I'm like, God, that looks good. And I picked it up and thought about it for a bit and then put it back and got the plain apple pie. So we're getting there. Maybe in 3 more months, I'll bring home the raspberry one.
Sometimes I wish that people enjoy strawberries with chocolate and they get so excited about it in pies, but I mean, I could never eat that.
ARFID people, we won't give in. We can't because we can't tolerate the food that other people are eating.
ARFID is a real thing. It's not just kids being fussy. I mean, it probably can be sometimes, but ARFID does. It's sitting there, just whispering in your kid's ear pretty much.
I mean, it sucks what's happened to Jake, but I said if one positive we can take out of it is that we can not let it happen to other people and let other kids know that it is actually important to eat all your different nutrients and your vegetables and your meat and varied diet and not just live on chips and bread.
We're not dwelling on it or worrying about what happened. We're just going on.
Jake's now spent several months away from home on his course at the Blind and Low Vision Education Campus, learning to navigate the wide world with newfound skills.
This afternoon we did train travel, knowing where the station is, how to get on the station, how to get to the specific area that you want.
He's even cooking meals for his flatmates. Luckily, there are 2 kitchens, and aside from an allergic reaction to some grated cheese, he's doing well.
They've got to cook, certain meals and stuff, so he rings and gets some recipes from stuff that we've cooked at home. And 9 times out of 10, it'll be, there's usually a bit of meat in there, there's a bit of carbs in there, and broccoli, because he really likes his broccoli. So I couldn't be happier with him eating stuff like that.
It's kind of shown me what I can and can't do. Like, at the start of the year, I didn't think I could do the cooking or the cleaning or basically look after myself. And when I started doing the cooking and the cleaning, I found that I could actually already do it.
Just him having the space to go out and do things, he wouldn't be doing that at home, and he's even admitted that himself. He said if I was at home, I'd just be in my room playing games.
And just being pure lazy and letting Mom do everything.
Right, Jake,
Yeah?
instead of me cooking on my birthday, you make me a bacon and egg pie.
I don't know, because that's 2 days after my birthday and I might want a break, like a week-long birthday break. I'm really proud of myself. I proved to myself that I can do this without any assistance from either friends or family.
Do you want me to keep going?